I am excited because we have a book giveaway. We are excited to share a few copies of Harlem Grown, How One Big Idea Transformed a Neighborhood. It's an really inspiring story about how food and farming can bring communities together. So if you look under your chairs, some of you will find a fruit or vegetable sticker. So look, and if you have one, hold it up, and a food team member. Yeah. And they're signed by Tony Hillary. Sorry, she distracted me. So, all right. Hold up your hands. There we go, one over there. All right, while we're doing that, I'm going to go ahead and continue the conversations. Everyone settle down just a little bit. So, you're trouble. We're going to turn to our next session on food as medicine and eating for health. Joining us for this panel, we have Tanya Fields, the executive director of the Black Feminist Project. Give her a round of applause. Woo, woo, nice to see you. We have Dr. Christine Cowin, who is the senior advisor of the Food Security Program Office at the U.S. Department of Veteran Affairs. Give her a round of applause. Jilly Stevens, the amazing Jilly Stevens, is the CEO of City Harvest. Leslie Gordon is the president and CEO of Food Bank for New York City. Give her a round of applause. And moderating this session, we have my friend Dana Cowin, an award-winning journalist and the founder of Progressive Hedonist. Give her a round of applause. Over to you.
Thanks, Danielle. Danny. Getting really fancy here. So have you guys been sitting for a long time? I just have to ask. Can you just get up for a second? It's food is medicine. We got to be healthy. Just shake it off, because I do want you to be like awake and ready for this amazing, incredible panel. All right. Thank you for shaking it. I can sit down. So we've heard a lot about food as medicine, and what excites me so much about this extraordinary panel is that we have another set of perspectives, right? This is a panel that adds to so many of the things that have gone before it. And so just to get us started, I'd like to ask each of you about the work that you're doing with your organizations within Food as Medicine, and then bring it to life through a story of one fine person. So Christine, I'm going to start with you, because you have the broadest mandate with 9 million people in the largest integrated healthcare system in the United States.
Yeah, thank you. So thank you, Danny. I was going to open with that. A lot of folks don't realize that the VA is the largest integrated healthcare system in the United States, and we care for over 9 million veterans. And we're really excited. We have been doing this work for 10 years. We have been screening veterans for food insecurity formally since 2017, which means every time a veteran comes to an outpatient clinic, once a year they get screened for food insecurity. If they're admitted to any type of bed, inpatient medicine, surgery, psychiatric, rehab, they're going to get screened. And what that means is that we have a ton of data. And so we were successful in actually building an office dedicated to food security. So the VA also, not only being the largest integrated healthcare system, we're also one of the only ones that has an office dedicated to food security. And our office is interdisciplinary, which we feel is really important, because we always say it's no one discipline's job to solve for food insecurity. So our office has dietitians, nurse, social worker, and then administrative staff and folks that do comms and legislative affairs. But what's important is that it's a real continuum. Mm-hmm. So the veteran comes in and more than likely is going to be screened by a nurse. And let's say they screen positive, the nurse is going to start to do a whole host of things. They're going to start to do a med reconciliation, like, oh, now I know that Mr. Jones in front of me doesn't always eat, but I see he's diabetic and he's on insulin. This is something I need to make sure that we think about. They're going to start looking at their labs, and they're going to interpret the labs differently now, understanding that there's all this other chronic disease going on with their medications, and then lay on top of that they're not consistently eating healthy food. And so then they pass the veteran in the VA. What's really nice is the power of the VA is our integration. So because it's an integrated system, when the veteran screens positive, he or she is asked, would you like to meet with a social worker or a dietitian? And they could say yes to both. And so then the social worker wraps their arms around them and starts to case manage them and make sure they connect them to all the things that meet their needs. Because we all also know that it's rare for food insecurity to exist in isolation. So if you're food insecure, there's probably other things happening. And so the social worker is the perfect person to connect those dots and then hand off to the dietitian, who can now say, all right, let me talk to you about like, where are you? Like, where do you cook? Where do you store your food? Do you have a refrigerator? Do you have a microwave only, or only a hot plate? What do you have? And then customizing that. And the dietitian's able to bring them the medical nutrition therapy, which only an RD can do, which means that they combine their nutrition needs with their diagnoses. So if they're hypertensive or cardiac disease, whatever it is, connecting all those dots. And so to your point about like connecting the dots with one veteran. So I'm going to tell you about a veteran actually right here out on Long Island who went to the VA. He had been homeless, and he had never used the VA. And someone finally told him to go at the time he was living out of his truck. And his daughter was using the VA, who was also a veteran, and she convinced her father to go. So he goes and he gets screened for homelessness and food insecurity, because all veterans, they get screened at the same time. The reminders are attached to each other. And the veteran screens positive for both homelessness and food insecurity. The social worker, he gets assigned to a social worker immediately, gets him into the HUD-VASH program, so now that they can get him a house, and he gets his vouchers and he's living there. But they also connected him to the local food bank out on Long Island, similar to City Harvest. It's called Island Harvest. And there's a partnership, a formal relationship that the VA has with Big Feeding America, and then you see it in our individual medical centers and local food banks. Anyway, connected him, and we had a program aligned with Island Harvest where they have a mobile food pantry that brings him food on a regular basis. He was so excited with the food that he got, and in the house he was living in, there were other people who had formerly been homeless, that he was sharing his food. And then he told Island Harvest he loves to grow things, so they got him seeds and starter plants. So then he started growing his own food and started canning, and he would grow all the food so that he had it all winter long and was sharing it with his neighborhood. And I share this with you because this one veteran went from living in his truck to thriving in a community where he was sharing the food he was getting with others. And we think that's a win.
So, Tanya, I'm going to pop to you next because you're quite at the other end of the spectrum, right? You're community-based. You probably know many of the people who come to Black Feminist Project. So can you tell us about the work that you're doing and,
Yes. So I founded and run an organization called the Black Feminist Project based in the South Bronx. I am not a doctor. There's no DR, NP, PA, none of that stuff behind my name. I am the mother of 6 children that I've raised in that community. And when I first came to that community, my second child, I was very young, 23 years old. I had a child who was almost asthmatic from birth, it seemed. We were dealing with all of these different respiratory issues. And much like the doctor said, all of these things are intersectional, right? If you have one thing that exists, most likely there's an intersection of those things. So as I'm trying to figure out what is happening with my very asthmatic child who's been hospitalized twice before her first birthday, but has not received an official diagnosis of asthma, I'm starting to get to know my community, that while I'm of my community, I have some things that might be different than my community. I have social capital, I have educational capital, right? I'm in school at the time. I'm coming from a stable background in terms of my family structure, right? I'm a young marginalized mother, but I do have support in terms of extended family. And so I'm starting, and then I'm going to school for political science, right? So like now I got access to some language. I can throw some language around, you know what I mean? You know what I mean? I can tell you why this stuff is happening. And so I started to arrange and organize the mothers in my community, right? The women who look like me with the fingernails, right? And the teeth and the big earrings and all of these women who get shut out of these places, but who are in fact the experts of what's happening to them and why it's happening to them, right? And so I'm about to start saying some things to y'all that might make some of y'all uncomfortable. Good. If we're gonna talk about health in this country, you cannot talk about it in the absence of gender and race, right? And so when we come into these rooms and we sterilize, no pun intended because we're talking about medical stuff, and we sterilize these conversations and make it seem like these discrepancies and these disparities do not exist because Black women are penalized for being unmarried mothers, right? And we're not talking about this in the form of wanting to attack the autonomy, the bodily autonomy of women, and in particular Black and non-white immigrant women, if we are not having these conversations and talking about how these systems are intentional. This is not happening just because it was an accident. This is happening because somebody wants it to happen. It's happening because somebody is profiting from it. And we have to acknowledge the duality of a medical system that is in fact invested in keeping Black women and their children sick. So when I think about food, I am thinking about it as radical resistance. I am going against a system that very much benefits from the experimentation of my body. So I was like, we're gonna go out here and all of these plots that are in our community that y'all said was a deficit, we're gonna turn them into an asset. And I started liberating these plots. The police called it trespassing, but tomato, girl. So I started liberating these plots and we started growing food. And so it's really interesting that this panel happened because yesterday I'm in this, because I'm gonna fast forward, because there's a lot more to that, but I'm saving it for the book, y'all. Don't forget my name. And so we're gonna fast forward to, I've done this now for 13 years. Okay, and I'm in the garden.
Are we going to talk about chickens?
Huh?
Are we going to talk chickens?
We're going to talk about these chickens, which I call the Bronx baddies, okay? So I have 50 Bronx baddies that we use for eggs. We get about 300 eggs a week, okay? My girls are productive, okay? Because they know ain't no free lunch. Listen, I'm like the Players Club over here. Make the eggs, don't let the eggs make you. So I hear this little voice going, excuse me, I want to see the chickens. Now, I've got the gate closed. I'm getting ready to go home. I am tired. I got to go back to my 6 kids. Now, somebody else's child is bothering me. I'm like, okay. So she was so insistent. I look up, and this little girl who looks like a muñeca, she looks like a Dora the Explorer. Seriously, she's got the two little things, and it's cut in a bob. And I'm like, how can I deny this face? I can't tell this baby to go home. So I open up the gate, and as soon as she comes in, it's on my Instagram. If you follow me on Instagram, Tanya Denise Fields, you'll see it because it really happened for real. I'm not making it up.
And you're going to make it short because we won't have time for everybody.
Yes, and so she comes in and I say, can I hold your hand? Her father's legally blind, so he says, I'm going to trust you to not slip off with my child. I said, okay, Dad, I got 6, I don't want yours. And so I take her to the back, I show her these chickens, we pick these eggs, and when we get ready to leave, she says to her mother, Mommy, I picked eggs. Core memory unlocked for this baby. She got to walk into this place, see this like 6-foot Black warrior show her how to pick eggs right on her block next door. Now she's telling me she's gonna come back and see me anytime that gate is open. This also is part of the medicine. It's about whole communities. It is about how are we creating quality of life holistically. And I am so tired of people coming into the community like the Bronx and only talking about us through the lens of pathology. There are good people and good things that are happening in the Bronx in spite of and because of, and we need to think about them when we think about medicine as well.
And good eggs. And so for Jilly and Leslie, when I think about food rescue, I think the way back old days, right? When there's a lot of bread. And things have definitely changed so much. And Jilly, let's just start with you, with City Harvest and where food as medicine has inserted it, or have you inserted it in the mission and the actions?
Yeah, definitely. Probably started about 20 years ago when the city started releasing data that showed us that the same neighborhoods we were bringing food were the neighborhoods where we're starting to see very high rates of diet-related disease. And at City Harvest, we really started to double down on making sure we were bringing as much fresh fruits and vegetables as we could. And I'm going to make this fairly quick. As you said, Tanya Denise, fast forward to today. This year we'll rescue and deliver over 86 million pounds of food. Over 70% of it will be fresh fruits and vegetables, most of that high variety. We've moved away from the hard 7 being predominantly what we're bringing. What's really important about that is ensuring that the families and the individuals that we serve with that food have the confidence to use it and to change behaviors. And so that's where nutrition education becomes critical, no matter what form that takes, whether it's a series of courses or nudges or a cooking demonstration. But to get to your question about one example, I'm thinking about a preschool we used to bring food to. And we took a delivery of pineapple. And we heard from the woman who ran the program that these, again, little kids couldn't get over how something that hurts so much when you touch it on the outside was so delicious and sweet. And they loved it. but here's where, from my perspective, impact happens. Is when the family uses their own very scarce food dollar to make a different decision in the store. Because it's a risk for people to buy food that they're not familiar with. And so that same teacher let us know that one of the moms told them that their daughter had persuaded her to buy pineapple in the store that weekend. So that's when the real impact happens, when a scarce food dollar is being spent differently. Kept it short. That's it.
We can't avoid the clapter. And same question for you, Leslie.
Sure. What a great panel, by the way, right? I'm so energized by my colleagues up here. Thank you so much. So at Food Bank for New York City, we actually have a different vernacular, for starters, that we use as we reflect on this space of work. So at our house, we call it food as health, for what it's worth. And, the way that we think about it is, no pun intended, food is often the carrot that brings people in. And so the question is, what can we do once folks have walked through this place of trust and familiarity and credibility to really wrap ourselves around them in the broadest way possible? And so with that in mind, the complexion of our partners on the ground throughout the great 5 boroughs of New York City include the likes of our larger hospital centers, federally qualified health clinics across the city, among some others. So making the healthy choice the easy choice at a place where you're already engaged in a conversation and have some self-awareness around broader health or diet-related diseases that you might be struggling with. Some of the things that we do include, in the past year or so, we've tested navigation. So not unlike what you heard earlier, once you've crossed that threshold, let's talk about what's going on for you. And so we've done some good connectivity to importance, and I cannot stress this enough, the importance of milestone screenings at specific cadences or ages. Those have been proven to catch things well before they progress into a place that you're going down a road that becomes really challenging. So as an example, we've got some great stories where we've partnered up with mobile screening units, as an example, in communities. Mammogram screening unit. We had one client that we were serving that went through a mammogram screening unit, and thank God. It's not what you want to hear or learn about, but she was able to catch it early, and so that's a blessing. We have somebody else who has shared with us, because of the connectivity, as an example, to fresh fruits and vegetables and really a variety of whole foods. She was able to better manage her A1C levels, better able to manage or lessen her rate of body mass index, and as a result was able to then participate in eye surgery, of all things, that she needed desperately and couldn't because, as an example, her blood pressure and blood sugar was just much too high. And so, look, it's not rocket science. If you talk to the older generations, your grandmother, your grandfather, they will tell you that it's the basics. If you can name the food, if you know what's in it, whether it's a pineapple or something else, it's probably okay for you and good for you at that. It's when you can't pronounce what's in it, probably not a good sign.
Yeah. have just a short minute left. And we've talked about the successes, and it is extraordinary because each of you has created so much success within your communities. But there's also so many challenges. I mean, there's no more challenging time like the present. And, they reset our clock.
Oh, yes.
Oh, yes.
Phone friend.
They must have liked the question. So I would just love to hear not just the challenge, but what your perception of that, the solution to that is, right? Because, and if anyone in this room is possibly part of your solution, speaking directly to the audience, what that could be. So let's just go in reverse order because it always seems fair to flip it.
Sure. So, as I think about this more broadly as a system-wide issue, one of the challenges is data, right? For somebody who's reasonably nerdy, and I'll admit I'm a little bit of a data geek, there may be data on the same person. Let's call this person Mary Lynn. Mary Lynn may have data, at a pantry level about her health. Mary Lynn has data with her physician at a certain level. Every place she goes within a, quote, health-related system has different data. And so in many cases, there isn't a full profile of a person that exists and is easily accessible by the full scope of people who are there and accessible to help Mary Lynn. That's been an ongoing challenge here in New York City and New York State. Is there
a solution?
Yeah. So part of it is really laying down the swords, to be perfectly honest. There's intentional competition, very unfortunately, especially in the healthcare space. Everybody wants their own electronic medical record system for different reasons. Part of it, quite frankly, is about competition. So it's about opening up the dialogue and finding spaces where you can share rather than making the roadblock why you can't or why we shouldn't.
Okay.
So pushing past roadblocks for shared conversation.
Jilly.
I'm going to talk about the sheer need when it comes to people who need emergency food in New York City. In 2019, we saw 25 million visits to food pantries in the city. Last year, we saw 47 million visits. And we haven't yet seen the effect of the $187 billion that are being cut from the SNAP benefit program.
Solution?
Layer on top of that, this weekend, the federal government announced that next month will be the last food insecurity report issued, so that will serve to mask the number of food insecure people. Solution is let's all just be hyper aware over the coming years that our neighbors continue to need help, and we'll do all we can, as I know the food bank will, to get as much food out to them as possible.
Awareness and money.
We need support to do
We need
that.
support.
Yeah.
Sure. Yeah.
Sure. So within the Veterans Affairs, I'd say our barrier or challenge is that not all veterans use the VA for healthcare. And we do know that research shows that veterans who use VHA for healthcare have better clinical outcomes than veterans who don't. So
Solution?
if any of you encounter a veteran, wherever you work or whatever nonprofit or wherever space you are, to encourage them to go to the VA and enroll for healthcare.
I know, I gotta be super fast.
Yeah.
So the problem for organizations like mine, capacity. Capacity translates into dollars. This story makes y'all feel good, that's great. But like we get online, we try to get that story out there, and we know that these apps are the op. They are suppressing any kind of thing that is a social justice driven and minded. So the solution is fund organizations like mine. You can start with mine. We're trying to get a chicken coop. We've been asking people to donate $10. You can get online right now, donate $10 so we can get a new chicken coop for the Bronx baddies. And fund other organizations like
chicken
this.
coop?
A chicken coop is like $5,000. It's not a lot of money, but it, for like 50 hens, that my girls need a mansion. And so fund other organizations, particularly making sure there's an attack on DEI right now. Look for the organizations that are being led by people who are women, who are black, who are immigrant, who are not white, who are disabled, who are queer. Fund those folks. Also, be out in these streets, y'all. Be out in these streets.
All right, thank you all.